case study tracing a missing healthcare volunteer, Malawi client background. A UK-based international health NGO contacted Bond Rees to locate a missing healthcare volunteer who had gone silent while working in Malawi. The volunteer was in the country to support a maternal and child health project in rural communities across the central and southern regions. The NGO became increasingly worried when the volunteer missed several scheduled check-ins and did not respond to satellite phone calls or messages for over a week, particularly given the remote locations and potential health risks in the area. The investigation Bond Rees began by gathering all relevant information, including the volunteer's planned schedule, recent contacts, and communication history. The volunteer had been staying in Lilongwe, the capital, and was scheduled to travel by road to several remote villages in the Dedza and Mangochi districts to provide medical training and distribute essential health supplies. The last communication from the volunteer was a satellite phone call to the NGO, confirming their departure by vehicle to a village near Lake Malawi. Digital footprint and local contacts. Our digital forensics team conducted a thorough analysis of the volunteer's digital footprint, including satellite phone records, GPS data, recent emails, and social media activity. The last known signal from the satellite phone was detected near a rural road leading to the village, but no further communication was recorded. This raised concerns about a possible vehicle breakdown, accident, or health emergency in an area with limited infrastructure and healthcare facilities. Bond Rees reached out to local contacts, including local NGOs, community leaders, health workers, and transport providers to gather more information. Several contacts confirmed that the volunteer had been seen leaving Lilongwe in a rented vehicle but had not arrived at any of the scheduled villages or health centers. On-the-ground investigation in Malawi. With these leads, Bond Rees deployed local investigators in Lilongwe and the surrounding areas to conduct discreet inquiries. Our team collaborated with local community leaders, health workers, and transport authorities to retrace the volunteer's route and check along the roads leading to the targeted rural areas. After several days of investigation, we discovered that the vehicle carrying the volunteer had been caught in a flash flood while crossing a river on a poorly maintained road, becoming stuck in deep mud and unable to move. Further inquiries revealed that the volunteer had attempted to walk to the nearest village for help, but had become lost in the surrounding bush. Fortunately, the volunteer was found by local villagers who provided shelter, food, and water. However, due to a lack of communication networks in the area, the volunteer had been unable to contact the NGO or seek further assistance. Outcome Bond Rees quickly confirmed the volunteer's location and condition, providing this critical information to the International Health NGO in the UK. The NGO coordinated with local contacts to arrange for safe transport back to Lilongwe, where the volunteer received medical attention for mild dehydration and exhaustion. Although tired from the ordeal, the volunteer was found to be in good health and able to continue their work after a short period of rest. Why Bond Rees? This case underscored Bond Rees's expertise in locating missing persons in remote and challenging environments like rural Malawi. By combining digital forensics, local intelligence, and effective on-the-ground investigations, Bond Rees ensured the swift and safe recovery of the missing healthcare volunteer. Our commitment to supporting international organizations and safeguarding their personnel, even in the most unpredictable and isolated locations, remains steadfast and dependable.